I sound such like a millennial.
And like, are young folks even thinking about HIV? I think oftentimes people assume that folks who have multiple partners are more at risk getting HIV or an STI, but sometimes it takes that one person.
I'm a straight guy. There's not a lot of place for these kinds of conversations within my own community.
I think you also see it, like, particularly with like the language that people use in everyday conversation, particularly on like hookup apps. Like, are you clean?
Often the stigma around HIV means people don't feel comfortable disclosing, or they do disclose and then they get a negative reaction and they don't really get the support that they deserve.
HIV stands for human immunodeficiency virus, and human immunodeficiency virus can be found in a number of different body fluids.
HIV is a viral infection that can be transmitted by blood, semen, or other sexual fluids, and it is a chronic infection. If it's untreated, it can affect the immune system and cause people to be at risk for opportunistic infections or infections that wouldn't otherwise make people sick.
Yeah. Anyone can be at risk for HIV.
Mm-hmm. Especially in Massachusetts, you are not required to disclose your sexual health. There is no criminalization for transmitting.
You don't get good at having the conversation without being bad at the conversation first.
If you're engaging in casual sex or if you have a partner, just making that, hey, checking in, and then go on and have a great time.
Treating it just like any other conversation.
Yeah, basically, normalizing it.
Yeah.
So PrEP is medication to prevent HIV, and there's multiple forms of PrEP. There's injectable PrEP. There are pills that folks can take every day. PrEP is great for everyone. It's great for men, for women, for non-binary folks, anyone who has risks for HIV.
Anyone who feels like they want to be more protected against HIV should use it. And it's available in many locations, free or low cost, all throughout Boston and the nation.
Yeah, and there's some services where it can get delivered right to your door.
Yeah.
Mm-hmm.
Just important for us to note that PrEP, in the forms that I mentioned, does not protect you from other sexually transmitted infections.
I ended up having unsafe sex, and then I was like, oh my God, what do I do? So I saw my provider, and they were like, it's okay, it's 24 hours later, you're within the window of the 72 hours. Here's PEP. This is post-exposure prophylaxis.
PEP is post-exposure prophylaxis, which is medication taken after a possible HIV exposure, so after a sexual encounter or after a person maybe has injected drugs. And it's a short course of HIV medications, usually about a month, that people can take to prevent HIV transmission after they may have been exposed.
I think a lot of what we do, especially with looking at harm reduction, is not just thinking about the needle exchange, but thinking about other ways of utilizing the drug. So meeting people where they're at. If they're not ready to cease use, can we teach them about other ways to safely use? So teaching them about how to safely inject, destigmatizing it so that they don't feel like they're alone. I think a lot of times people are ashamed of where they're at and what they're dealing with, and they don't want to talk about it.
It's a stigma.
Exactly.
It's a stigma.
And then also PrEP is an incredible option for people who use injection drugs.
U equals U, so that stands for undetectable equals untransmittable. And so it's a groundbreaking, historic finding that people who are living with HIV who are undetectable cannot transmit HIV to HIV-negative partners. And so what does undetectable mean? Undetectable basically means that people living with HIV who start taking HIV treatment or antiretroviral therapy, they should become undetectable.
It's almost like a new prevention method as well, because people living with HIV can have the opportunity to feel more safe and secure in their intimate relationships with sexual partners.
There's a new way to identify your status, which is not HIV positive or HIV negative, but I'm undetectable.
There's tons of resources throughout the city of Boston that you can get care for free or very low cost. Even if you don't have insurance at all, even if you're undocumented, even if you are homeless, don't have a job, anything. So yeah, yeah.
Go Boston.
Yeah.
There's HIPAA for a reason.
Period.
Period. Yes, it can be a little bit of an uneasy conversation to have, but I say things are only awkward when you make them awkward.
And I think we're really fortunate in Boston that there's a lot of different providers who can treat HIV. And so, you know, the same way dating, you may have to go on a lot of dates before you find the one. The same might be true with your doctor. And that's okay. It's okay to say, you know, I want to find someone who's a better fit for me.
There's sometimes when you're in a long-term relationship and you bring that up with your doctor, there's an assumption that you're monogamous, and that just sometimes isn't true. And you still have to ask the follow-up questions about what your sexual practices are, or maybe what you know about your partner's sexual practices as well.
My demographic, Black men, it's not common for us to want to seek help in general.
There's still like that internalized stigma that then, in that shame, that then makes people less likely to get care when they need it.
Stigmas come from a real place of fear.
Stop making sex a big deal. It's just sex. To normalize talking about sex is like the first step in being able to normalize talking about HIV.
So none of us are immune to stigma, right? I think we all, in various aspects of our lives, deal with that in a very real way.
Especially public health professionals, it's our responsibility to make sure that we are meeting the community where they're at, and we're bringing them in and effectively engaging community.
Boston definitely has your back. Boston is providing resources and opportunities for you to take the best care for yourself.